Thank you for that fabulous session, and we do recognise that some people do need to go home, but for those who can stay, we invite you to stay. And Mary, thank you for whetting the appetites of people about our RISE program, and we invite you to stay to hear more about the RISE program, which is a real action research program that takes all the principles that we've been hearing about in the last couple of days: community consultation, climate action, evidence generation for policy change, into a single, really exciting transdisciplinary program. So I invite you all to stay. I think we have a video that will start in just a minute, and I'd also like to invite my two RISE colleagues, Professor Diego Ramirez-Lovering and Professor Tony Wong, up onto the stage as we transition over.
Can we go now?
Planetary health is the international community coming together and saying, in fact, we can't have a healthy population without having a healthy planet.
Whole idea of the Wellcome Trust, Our Planet, Our Health, is that if we improve the environment, we will also improve human health.
We're inseparable from the environment. More people are living in cities, and more people will continue to live in cities. But our cities are not separable from the rest of the natural world. So we have to look after our cities and the rest of the natural world.
RISE is a randomised controlled trial involving 12 settlements in Suva, Fiji, and 12 in Makassar, Indonesia. We'll be randomly choosing 6 settlements in each of the countries to undergo a water and sanitation upgrade in the first phase of the trial. For the next 2 years, we'll then be monitoring the impacts of this upgrade on the health of the environment and the health of the residents. After that, we'll be upgrading the other 6 settlements in each city. We'll be examining the impact in many different ways, predominantly through survey data and through sampling. It's going to include taking water samples, soil samples, fecal samples from children, some blood samples, and also some trapping or sampling of mosquitoes and rodents.
Like in Makassar, many of our people depend their water need to the well, like bore well or dig well. Our water is much contaminated by bad sanitation.
The aim is to think about an intervention, a green engineering intervention, that will improve health outcomes for people living in informal settlements who don't have normal access to sanitation.
They are constructing natural-based projects like a wetland, building biofiltration garden, and also a sanitation system, which is environmentally safe.
So we have a very strong and committed relationship with the in-country teams, and we really appreciate that they have a lot of knowledge of working in these areas that we do not have. And so we're reliant on their local knowledge.
We know that individual health and ability to lead a healthy, happy life that's free of these diseases, especially that which is related to waterborne diseases or diseases related to sanitation and water. Once we are free from that, it enhances productivity, and it can get you to work and perform well in school, and it does have greater implication, not only for oneself, many other benefits to the families, to the communities, and to the nation as a whole.
we are trying to actually build something that would actually not only help the communities that are going to be the recipients of the project, it's actually trying to harmonize the environment.
People's health and well-being, that is matched to ecological health, that is matched to elements of the urban design and the built environment. We're going to get a really great picture of how people are living their lives and interacting with each other and their environment.
If we see changes in the environment and improvements in health, this will be a fantastic platform for rolling out this type of intervention into other areas.
The overall aim of the program is to provide rigorous evidence that this radically new way of providing a cleaner environment to poor urban communities improves health and is feasible.
Thank you. Come and take a seat. Thank you to those of you who have stayed. We won't keep you too long, we promise, because for those of you who have stayed, you are going to get the pleasure of some networking and refreshments after we finish our talk. So my name is Professor Karen Leader. We are talking about the RISE program that you've just been hearing about, which stands for Revitalising Informal Settlements and Their Environments. There are three of us up on stage who are the executive team members of the RISE program, and we're each going to talk very briefly about different aspects of this truly transdisciplinary action research program, which we think is a real exemplar of how to bring together planetary health thinking, as I said before, that has communities and communities' needs at its heart, that is completely engaged with communities to enable us to generate rigorous scientific evidence so that we can determine whether the approach that we're looking at for improving water and sanitation actually does have the impacts on the environment and on human health that we expect it does, and that we expect it will. And if it does, it will be a platform for future scale-up. I am going to talk about the science of the program, and then my colleagues are going to talk about a bit more about the intervention itself and our scale-up ambitions. But to talk about the science and to reflect on what we've been hearing in these last few days about listening to communities and working in communities that really are facing some of the greatest challenges. And as Mere said, we have chosen to work in some of the most vulnerable informal settlement communities in Suva, but also in Makassar, Indonesia. So RISE recognises that the scale of the problem of people living in informal settlements, which is already enormous, there are already 1 billion people living in informal settlements, is increasing, and that the urban environmental and health challenges that they face are all interconnected. The problem that the communities face are a lack of land ownership, a lack of services that most of us take for granted, including water and sanitation services, as well as the climatic challenges of flooding that you see in these slides, but also, and particularly in Indonesia, of heat and lack of adequate water during some of the hot seasons. So diversification of water supplies is also really important. Our approach was to combine the needs of the communities with the needs for scientific, rigorous evidence to inform policy by developing a randomised control trial framework that delivers infrastructure, water and sanitation improvement infrastructure to communities so that communities benefit, while simultaneously taking a range of samples that you might have been able to hear in the video, but ecological samples, environmental samples, human fecal and blood samples, and a range of survey information to understand the health and well-being of communities before, during and after the implementation of the water and sanitation upgrade. And by doing this, the way we're doing this is in a randomised controlled trial, as I said, where we have chosen 12 communities in Fiji, but also 12 in Makassar, Indonesia, totalling about 9,000 people altogether. Half the communities have been randomly assigned to get the infrastructure upgrade in the first tranche, or in the first arm. We will continue to monitor the impacts monitor the quality and ecological and environmental and human health conditions in those that are receiving the intervention and in those that are initially serving as controls. And then the control communities, or the 12 communities that are initially serving as controls, will receive the infrastructure upgrade. This is a 10-year program. To get this kind of engagement from communities and from governments, as Mary said, and to get the kind of engagement that we need for our research community to invest in a 10-year trial like this has been enormous. And fundamentally, at the heart of what we're doing is improving people's lives with infrastructure, but also using the infrastructure as a way to understand how particularly fecal contamination of the environment and poor water management impacts on mosquito breeding, on soil quality, on water quality, and on the exposures that particularly the vulnerable children under the age of 5 who do not have sufficient immunity to cope with exposure to environmental pathogens, how it impacts on their intestinal health, on their carriage of pathogens in their gastrointestinal tract, on the number and diversity of pathogens in the environment, the antimicrobial resistance genes that come from human stool that get spread through environments, and also on community well-being. So it is a true planetary health program that has required us to establish new ways of thinking and new ways of working and new teams that fundamentally work from the field to the lab and capture an enormous range of varied types of data as an exemplar for how to do planetary health research. This approach that we have of really wanting to understand the environmental contexts and how this influences people's health has required a transformation in the way we do scientific research. As an example, we want to know what the water and sanitation infrastructure does to fecal contamination in communities. Now, some of these communities are 60 or 70 households. The traditional way for understanding fecal contamination or environmental contamination is to take grab samples of soils. How can we understand the spatial distribution of pathogens using these traditional methods? You'd have to take an enormous number of samples repeatedly, analyse them all in the lab. It would be prohibitively expensive. So we've come up with new ways of understanding or monitoring pathogens in the environment through something you can see in the left-hand picture there, which we call boot socks, where essentially our field workers put on gumboots and then put on what is like surgical boots, and they walk consistent community transects, picking up soil and picking up pathogens as they walk through the communities. And it is those boot socks that we then analyse in our labs to understand spatially what we are doing to the environmental contamination. Pathogens and people are so intricately vulnerable to climatic challenges. The pathogens spread through communities if there's flooding. They're probably killed more quickly during hot environments. So part of what we are trying to understand is and monitor is how much flooding there is in communities. What is the ambient temperature and humidity in our settlements when we're taking specimens? How does this impact on people's exposure? We are asking really hard questions in a scientific framework and then also developing uniform methods for analysing our environmental and our human samples. And so the whole approach of thinking about planetary health research addressing these wicked challenges that we have to address in a way that also generates the science that is so important has required an enormous amount of effort, and we are deeply grateful to the researchers that work in the communities that tell us how to work with communities. This is absolutely an exemplar of North-South research where we in the Global North are learning how to do this work in a way that should be a shining light for transdisciplinary planetary health research. You can see here our teams in Fiji in the top and Indonesia in the bottom. And it is these team members who have the deep connections with the communities and who are maintaining our presence there. So on that note, I want to pass over to my colleague, Diego Ramirez-Lovering, to tell us just a little bit more about the infrastructure.
Thank you very much, Karen, and good evening. I'm going to try to emulate Renzo's energy from the last presentation, which I thought was phenomenal. Okay, so Mary, I think, did a wonderful job in actually presenting what we're trying to do in RISE, and really I'm going to in some way just give a little bit more context, but I think you've captured it really wonderfully, so thank you for that presentation. The intervention, the infrastructure is something that in some way is quite a novelty. It's a novelty because it is trying to address the multiple pathways, the multiple challenges that each community faces. Now, there are elements that are repeated, and I'll explain those in a second, but we do need to understand what are the contextual challenges, to use, again, Renzo's term, glocal. Unless you're able to locally adapt and understand what are the specific challenges, one-size-fits-all approach is not going to address what is most needed to address these challenges. So the RISE intervention then includes a number of different elements from sanitation, probably at its heart, trying to interrupt the fecal contamination pathways. So building new toilets, providing a sewage treatment system consisting of a septic tank and then constructed wetlands and additional elements which are trying to also address the contamination pathways, so flooding, as was mentioned, so improved access and drainage, and other elements as related to the specific context problems. So this is a video that explains a little bit what we've been trying to explain before, but I think it's quite a clear explanation of what the process is for different types of wastewater. So gray water going into biofilters, black water going into a pressure tank, septic tank, and then through constructed wetlands that use biochemical processes to clean the black water before it's safely let out back into the environment or reused for different purposes. So the nature-based solutions, green infrastructure, even pressure sewers, septic tanks, none of these are new technologies. They've been around for some time now. What is perhaps new and what is novel here is their application in informal settlements. So informal settlements, again, you've heard about it before, in some way capture all of the vulnerabilities, and I actually like the word risk, as was introduced in the last session more. They're an accumulation of all the risks that face developing world cities, especially in the face of climate change. So congestion and overcrowding, lack of sanitation, lack of potable water supply, insecure tenure. So all of these challenges are represented in informal settlements. Now, as Karen mentioned, there are 1.1 billion people living in informal settlements today. That number is expected to rise to 3 billion by 2050. So currently it's about 15% of the population. By 2050, it'll be 1 in 3 people living in informal settlements. So the challenge is enormous. Interestingly, most of that growth will actually happen in our region. So it is upon us then to really put that front and center in terms of moving forward with urban development, with climate change adaptation. So I think this really goes without saying, but at the heart of these solutions is really deep and meaningful partnerships with communities. And I think that has been an undertone of this whole conference, and I can't really stress how important that is, in fact, to the success of these types of projects, to the success of decentralized solutions generally. Communities have to support them, they have to feel ownership. Without that, you really are not able to operate. So we've spent an enormous amount of time and resources, very important that you really are resourcing this properly, to develop these very, very significant partnerships with communities and go through a series of steps which we think is sort of best practice engagement with communities to develop what is the best approach for each intervention in each community. From engaging with people with disabilities, engaging everyone in the community in the co-design process, to also engaging local experts, both technical experts and social experts in our field teams, recognizing land rights, issues of land, Mary knows these well. They're enormous. These are communities without legal tenure. They have never been surveyed. There's land conflict. So unless these very fundamental things can be resolved, you can't even provide infrastructure. So these are the kinds of things that we need to address, to develop safeguards, social safeguards and environmental safeguards, so we're protecting people and the environment. And probably most importantly, to ensure that the co-design processes are locally anchored and implemented. So the teams there feel the ownership of the process, develop the process, and deliver it over a period of time. Okay, so this is a before and after of one of our communities in Indonesia. And I guess the story here is that not only, as Karen was saying, are we trying to deliver new evidence, new scientific, rigorous evidence of how to address these grand challenges and learn lessons that can be applied elsewhere and deliver this kind of approach elsewhere, but we're delivering impact. So we are, in effect, beyond just water and sanitation, we are addressing the climate crisis, delivering climate-resilient infrastructure, and also, I think a very important part of this, because of our deep partnerships with community, developing a kind of increased social capital in communities and communities' ability to then come together when there are other other issues, other risks that are facing them. So this is a little taster, sort of hot off the press, of the infrastructure that is for the first phase in Indonesia, and Fiji is following closely behind, but I just thought I'd show you some photos of this. And this is multiple elements of the infrastructure system. We've delivered about just over 3 kilometers of drainage and access, 53 new bathrooms, over 100 bathroom renovations, 284 connections to new bathrooms, 66 pressure tank systems, 284 rainwater tanks to support alternative water supply, 25 large wastewater treatment wetlands, and I think what's interesting here is that it's one of the few projects, I think, or maybe it's one of a kind, that is delivering at scale these large infrastructure systems and then rigorously testing the efficacy of these systems over a long period of time. I'll leave it there, so I'll pass now on to my colleague, Professor Tony Wong, to talk about what happens in the future.
Thank you, Diego. And I'm probably the only engineer in the room, but you can see that the whole combination of different disciplines do need to come together if we are invested in ensuring that the rigor of the science, the innovations, both in terms of scientific evidence, in community engagement, in delivering innovation on the ground, come together. It would only mean something to all of us if we can actually think about a strategy for scaling up the work that we've done. The research work that we've been embarking on in the last 6 years is really a combination of getting evidence that the interventions do deliver the outcome we're looking for, getting evidence that the ideas are implementable in a developing context, and ultimately creating the right environment for upscaling. That right environment for upscaling really does include also the way that we build the type of knowledge, local knowledge, in-country knowledge, to ensure that the legacy of the research work and the evidence can actually continue on over the next 20, 30, 40, 50 years. One of the things that we've certainly embarked on here is really to think about what are some of the foundations we need to establish to ensure that the concepts that we've developed are ready for upscaling. And there are quite a number of them. Yes, we are running a randomized controlled trial, but that is really just one part of our upscaling readiness. We need to demonstrate, as we have, the constructability of some of the intervention in a developing country context. We have demonstrated, for instance, that in a dense informal settlement, that those solutions can still be implemented under those conditions. We've also demonstrated the power of co-design and the process behind co-design, in the sense that it's not simply a case of coming to the community and asking them what is it they want, but actually to empower a community with knowledge to start with in terms of their exposure to oral fecal contamination, how they interact with the environment influence that level of exposure, and then to provide them with knowledge on what are the type of the interventions that could work, and then let them determine how is it that those interventions could fit into their community. And we have documented that. We have, for instance, also documented, because we worked in 12 informal settlements, 6 in Suva and another 6 in Indonesia, whereby they all have different biophysical contexts. Every informal settlements have their own unique characteristics of oral fecal contamination pathways. We are able to show and demonstrate that the interventions that we deliver are able to adapt to the biophysical context, and therefore the robustness of the interventions. We are able to demonstrate through a lot of our field monitoring and the genomics work that we do, the connection between contamination on site and the contamination that ultimately gets into the gastrointestinal systems of children under 5. we were able to establish that connection, which immediately tells us that if we can come up with means of interrupting the oral fecal contamination pathways, we would have delivered a proof of concept that you can expect that gastrointestinal health of communities in those settlements will start to improve. And there's a whole range of other things. We've been monitoring our intervention to make sure that the efficacy and the performance of those systems are. And throughout all of that, we were able to, because of our engagement in the community, progressively build the social resilience in our community. The fact that they understand their relationship with the environment they live in, they understand their exposure, can actually start to influence their behavior. And the combination of the social resilience we've built together with the infrastructure resilience that is part of our interventions are really part and parcel, two sides of the one coin, the resilience coin in those communities. Now, they are stepping stones to upscaling. What the work that we've done are providing those stepping stones to de-risk the process of upscaling and to actually provide the pathway for an alternative solution for informal settlements, bearing in mind that there are over 1 billion people in informal settlements, and they are places where mainstream services in every city would not go to, simply because it was too hard. And yet, we needed to ensure that work needs to be done, that there are people that have been left behind in the past are at least given an opportunity to flourish. And with that, we have now seeded different pathways, different solutions, alternative to mainstream solution that is able to accommodate that cohort of people that is often forgotten. We are able to form new partnerships and enthusiasm amongst government departments to show that there is an alternative way to deliver health outcomes for the poor and vulnerable in those communities. The type of government support that we have through the evidence that we provided is giving us great hope that, in fact, there are opportunities for us to start to think about how we can provide alternative solutions to those communities. An alternative way to fund them. One of the things that we have also done is to create hybrid solutions for servicing some of this infrastructure, a combination of community participation as well as government investment to actually start to look at the servicing and the operation and maintenance of these systems. We have also seen that there are interests both in government funding and philanthropic funding to come together to actually deliver a lot of these outcomes that we have. They are part and parcel of the stepping stones in preparing the project for upscaling. And so I'd like to end with this notion that someone asked Mary, I think last question, why did we choose informal settlements? We chose informal settlements because if we can show and demonstrate solutions for informal settlements in one of the most inhospitable biophysical conditions that they live in, we actually have solutions for every possible challenges that are faced by people that are exposed to the lack of fundamental services that underpins their health, that of water and sanitation, flood protection, and generally protection from contamination in the environment. I'd like to invite you to perhaps come and speak to us a little bit more, think about some of the questions that you may have that I'm sure we are able to answer. But on that note, I'd like to thank you for your attention. I want to give the floor back to Karen.
I think that's enough of us talking. We do invite everybody out into the foyer. Refreshments will be served. We will hang around and be very happy to discuss our work further. Thank you again for your participation, your interest, and for staying extra time today.